Because that's the goal of apoptosis. It has to kill the cells. So by fragmenting the DNA, the DNA is already, as you say, abnormal. It can be abnormal. It's intrinsic. So fragmented DNA, the nucleus is pyknotic because of that. Remember the pyknotic nuclei in apoptosis, and after that, the third thing is what? Phagocytosis. The cell is died, so the macrophage will come and do the phagocytosis. So three events in apoptosis. And why I'm discussing apoptosis? Because tumor suppressor gene is so important in apoptosis. P53 has one. So it has big role in apoptosis.
P53, it always initiates apoptosis. It doesn't
intrinsic
repair.
No, it focuses on repair, right?
P53 it will stop if there's DNA damage, it will stop P1 and ask the gene to repair it. If it fails to repair, then it will induce PAX3. So P53 wants to repair itself. It's just arrest itself. There are other genes that will repair. Yeah, so P53, it won't do the repair. It will arrest the cell at T1, ask other genes to repair. If it fails, they will ask PAX to make more than that. One, very important. The cancer, that's the. Okay, tumor suppressor gene. So I discussed the cell cycle and apoptosis because these are both important tumor suppressor genes. Tumor suppressor gene, the Knudsen theory. Okay, two groups of patients. معي يا شباب. نيوتن ثيوري قلنا لكم last time في الأونكوجين tumor suppressor gene. نيوتن هذا اسم الشخص اللي اكتشف الثيوري. بالكيمات تلفظ نيوتن ثيوري. الكي ما يقول اسمه كذا. Two groups of patients, those with family history and those without family history, familial and non-familial. Familial form, present earlier يعني familial cancer. Familial cancer leading tumor suppressor gene mutation leading to familial cancer. Present earlier in childhood, often have bilateral disease with an eye, could that be multiple, retinoblastoma. Sporadic present later, only had single gene mutation. Let me show you example. Retinoblastoma. Knudsen theory كلها retinoblastoma. تعرفون retinoblastoma? You know what's retinoblastoma?
I can't know.
Yeah, retinoblastoma is malignant tumor of retina. Malignant retina, you know retina, right?
Yes.
Malignant tumor of retina and affecting cat. Yani you have, let me tell you, you have two types. Malignant tumor kids, affecting kids. Yani two types of retinoblastoma. Sporadic, the majority of them are sporadic. Yani patient has one eye involved. One eye involved. He is 5 years, 6 years old. He comes with the big tumors eye. So white eye. They call it white eye. But familial, both eyes are okay. And come alien like he's 1 year, 2 years old. But these are few cases. We see يعني one or two cases of retinoblastoma every month. But we see a familial one case every 2-3 years. But they are uncommon. The gene that was involved, mutation were needed. This gene called retinoblastoma gene. So, tumor suppressor gene, a gene should be involved, and the gene is called retinoblastoma gene. Normal people have 2 copies of the gene. So we have 2 copies of retinoblastoma gene. Every person, 2 copies of one from father, one from mother. Need to have loss of function mutation in both maternal and paternal. This is the Knudsen theory, like the brakes. Yeah. So there is loss of function, whereas the oncogene gain of function. صح?
Yes.
Okay. Someone come and explain.
Salman.
واضحة سهلة.
Okay.
Bismillahirrahmanirrahim. As we can see, here we have pedigree.
هذه كلمة يحتاج تسويق.
Okay, so here we can see that this is the hereditary one. This is male and this is female. Here we have like parents.
Affected and unaffected.
Yeah, infected. Here we have the normal or unaffected, not affected. Okay, and here we can see that it's transmitted to the next generation. Then there is marriage. Okay, then it's transmitted to both sexes. So we can say that it's for males and females. Both of them are affected, and so it's in all generations, from the old one to the newest one.
So, what type of hereditary disease?
And you can say many tumors.
Yeah.
Male and female.
Autosomal.
Autosomal dominant. Autosomal dominant.
Yeah. So for tumor suppressor gene is autosomal dominant and sporadic. There is no familial.
No familial.
No familial.
It's not present in each generation.
Okay, good. So, شباب ركزوا معي. For tumor suppressor gene, so 2 copies has to be mutated for the cancer to occur. If there is only 1 copy mutated, the base, what will happen to the base? Only 1 copy is mutated.
Some may be affected.
Yes, it's so he has high risk of cancer, but he has no cancer. If 1 copy is affected, this patient has high risk. He is only one. He has more risk than the other person of cancer, but he has no cancer unless the other copies get mutated. So for the familial disease, there is germline mutation. He's born with the 1 copy, then he gets the other copy mutated later on in life.
But doctor, you just called it autosomal dominant.
Yes.
So how can it be dominant? You need 1 copy and you're affected, right?
Yeah, but 1 copy is still affected, but the inheritance is absolutely because you have 50% of the patient will be.
But if it was
There's no
dominant,
dominant gene. Like both genes have to be affected for him to be.
that's recessive, right? That you need 2 genes to be affected.
It's called dominant.
Now, two genes have to be mutated to for the disease, but the inheritance is dominant. The inheritance, the patient is not affected. The patient is carried out. These are carriers.
These are carriers.
Carriers. So that's related to you. The patient, when he is born, he has no cancer.
So that's recessive.
Because you have own mutation in your body later on in your life.
Yeah, the other mutation later on. So you carry this. If you are going to express it, these groups are but you are not expressing it.
So it's not that.
Did you get that?
So listen to me, please. So you have a patient who is born with 1 allele mutation. 1 allele mutation. Then later in his life, he will give the so when he's born, he has no disease. He's just carried. He has high risk of being of neoplasia. Then he later in life, whereas the sporadic, he has to get the 2 mutations later on. So the chance of having sporadic is much less. The chance of familial is much more. But there are much less. The number of familial is less. So mutation has to so sporadic in both copies of retinoblastoma. So the mutation to occur, it's very uncommon, very uncommon, and it takes longer period of time. Let me show you this. So, if this familial, the patient is born with 1 mutation. What we call this mutation? Yeah, but
Germline.
germline mutation. Germline mutation. then the chance is 1 in 10 to 6 to get a mutation in other gene. So then it's overall 1 in 10 to power 6 he gets the mutation. So there's more chance. Whereas if sporadic, he has no mutation when he's born. The first somatic, the second somatic. So 10 to 4. So more. What the point I want to make? They are more sporadic than familial, much more. But if he's born with germinal mutation, he has much more chance to get it.
Much more chance, but at the time of his birth, he's not. He doesn't have to.
No.
So you call that recessive, right?
No.
What was carrier? Carrier was it?
Half the gene, affected gene.
But the difference,
Recessive. You don't have recessive.
but the difference carrier won't be affected by the disease he's carrying. Here he's
I understand that. So why, if it was dominant gene, that even if you have one gene of
It is in the
Dominant in familia. It's dominant in familia.
So I want to remember some of these genes now. شباب ركزوا معي. And do you understand now the familial and sporadic gene? واضح? Now, I want you to understand that these are some examples of common tumor suppressor genes. So some of them might come in the exam. So you have to. This is the neofibrinosis gene, neuroblastoma gene we have. Then APC beta-catenin gene. This is very important in familial colon cancer. ABC gene, and in colon cancer, familial adenomatous polyposis gene, and neurofibromatosis gene. These are all tumor suppressor gene. Familial and P10 gene is in Cowden syndrome, and retinoblastoma gene in retinoblastoma and osteosarcoma. P53 is the guardian of the genome. The commonest tumor suppressor gene is P53. Then WT1, P61, BRCA1 and BRCA2 in breast carcinoma. So what you need to remember is the following. P53 is in Lee-Froment syndrome. I will show you the syndrome. And the gene P53 is, these are all tumor suppressor genes. So apply the same thing. Newton theory, 2-hit theory. You have to have 2 hits. Whereas oncogene, 1 hit.
Yes.
2-hit theory, and we said neurofibrinosis gene you have to remember, and the APC gene, familial adenomatous polyposis gene. I'll show you example. You have to remember, and P53 and BRCA1 and BRCA2. BRCA1 and BRCA2 is the more risk of familial breast cancer. BRCA1 and BRCA2 more risk. All these tumors suppressor genes. BRCA1, BRCA2 for familial breast cancer and ovarian cancer في سؤال عن الموضوع هذا واضح؟
Do we need
No, I wanted to know like BRCA1 and BRCA2 DNA repair carcinoma of female breast, P53 cell cycle arrest. So this you should know. The retinoblastoma regression cell cycle. We talk about all this. And neurofibromatosis, cytoskeletal abnormality. We didn't talk about this, so we don't. But ABC, inhibition of signal transduction. So and these 5 genes. So you شباب ركزوا معي. Neurofibromatosis gene, you have to remember all these tumor suppressor gene, and APC gene for adenomatous polyposis, colon cancer. And the retinoblastoma gene, regulation of cell cycle, retinoblastoma and osteosarcoma, and P53, the guardian of genome, they call it. It's most common abnormal gene in cancer. P53 in all cancers. Lee-Froment syndrome.
The most uncommon or
The most common. This is the guardian of genome. Then BRCA1 and BRCA2 is the carcinoma of familial carcinoma.
Right. The most common is familial.
Most of the female breast cancers are not familial. I want you to understand that most of the cancers are not familiar. Whether it's colon, breast cancer, all is not familiar. But those that are familiar associated with certain genes. Like in the breast, BRCA1 and BRCA2. In the colon, APCG. So is this clear?
But if there's familial mutation, it's more likely to get.
Yeah, yes. If there's once the patient has BRCA1 and BRCA2 mutation, then high risk of breast cancer and ovarian cancer.
إذا أنا ما في repeat.